So let's talk about some of the potential complications that we have here too, because there's so many ways to manage it, but these are the harmful effects of diabetes. Do me a favor and let's run through this here, because it would seem that there's a lot of things in here that together will tell you one thing, but each individual one could be something else that you have to look for.
Well, I'll tell you, diabetes affects 4 tissues generally. And these are organs or tissues that do not need insulin to get sugar inside the cells. Insulin, what it does, it facilitates the intake of the fuel into the cells. And there are 4 tissues that do not need that. One is the retina. That's why there's eye involvement. 2, there's the nerves. That's why there's peripheral neuropathy that leads to lack of sensitivity, that leads to ulcerations being formed because you don't feel any pain and you keep traumatizing the area. Next is the endothelial cells, which are cells that line the arteries, and that's why the arteries tend to be more blocked in diabetics, so they suffer from cardiac issues, coronary disease, strokes, and peripheral vascular disease. And then lastly, it's the kidneys. And it will affect the kidneys, and again, like I said, it's the most common cause of renal failure in this country today.
For whatever reason, I'm thinking of the word now about hypoglycemia. What's the difference between diabetes and hypoglycemia?
Well, hypoglycemia is actually low blood sugars. Diabetes is high sugars.